Okay, I don't know what's happening with my tech today, but it has been one thing after another. So I am sorry for the late start. I will wait here for a moment. I realize I'm streaming into a totally different place right now. It might take you a minute to find it. So I will just get my notes together and we will get rolling, okay? And let's see. I'm just pulling up my notes, you guys. Today we're talking about feedback and accepting feedback in nursing school. And it can be really hard for people, not just, the constructive feedback, but also even positive feedback. So, we're going to be talking about that as soon as I get my notes pulled up here. And I'm getting a million notifications on my watch. Okay, so let's get rolling talking about feedback in nursing school. And the problem with feedback and why it might be so challenging for some students is that they see it as a criticism when in fact it's just information. It is just information provided to help students improve and be the best possible nurses and nursing students that they can be. So I like to look at feedback as a gift instead of a detriment. I don't want it to bring me down. I look at it as a real gift from the person who's providing it to me, and it is really one of the most valuable forms of data that you can obtain as a nursing student. So give me a thumbs up if you can hear me, because I often have issues with that, but I think everything is working. Let's talk now about two ways that we accept feedback. So the first way is that we brush it off, right? We just brush off feedback. And that can be positive, or I don't want to say negative feedback, I'll say constructive feedback. So we either brush it off or we feel attacked by the feedback. Thank you, Joanna, for letting me know that you can hear me. So when we brush off the feedback, we're not taking credit for someone that gives us positive feedback. This happens a lot with students who have imposter syndrome. And then we also might brush it off because we don't want to believe it. If it was negative or constructive feedback, maybe we brush it off because we don't value the opinion of the person providing the feedback, or we don't take ownership of our own shortcomings, right? So that's one way. And the other way is that we feel like with imposter syndrome. Let's say you are getting feedback from someone and it's constructive feedback. I don't want to say negative feedback. When you have imposter syndrome, and we're going to talk about that a lot more, I believe August 13th, you feel like doubly attacked by this constructive feedback, and it really ramps up that cycle of thinking, I don't belong here, I'm a fraud, everybody's going to find out that I'm faking it, whatever it is, right? So feedback can be a really challenging thing for students. So here's what we can do about feedback. We're basically going to change the way we accept feedback and how we respond to the individual giving us feedback and how we respond to ourselves, right? So let's say you're the type of person who, when you get good feedback or positive feedback, you think, oh, I just got lucky that time. Like, let's say you're doing a skills checkoff and you nail your Foley catheter insertion. And instead of just 100% owning that accomplishment, you say, I got lucky, or that professor just grades really easily. Okay, you're not taking ownership of your feedback. Instead of doing that, how about instead you say, thank you. Coming from you, that's really high praise, or thank you. I worked really hard on practicing my sterile technique and I appreciate your feedback. That's all you have to do, okay? So that is one way. And then you can even take it to the next level by asking for more feedback, to say, do you have any feedback on how I could improve further? And this, getting into the habit of seeking feedback, is one of the best ways to break that cycle of feedback breaking you down. Okay, so going to the next level. Do you have any feedback on how I can improve further? So that's how you accept complimentary or positive feedback with grace, with confidence, with ownership. And when you do this, you are owning your accomplishments and showing that you take yourself seriously, you worked hard, you're going to take ownership of that. And then on the other side of that is that critical, constructive, I don't want to say negative feedback, but you know the type of feedback I'm talking about. How do you keep that type of feedback from letting you spiral down further into, that pit of nursing student despair, right? We've all been there. So the first thing I would recommend is look at it objectively and see if you can take your personal feelings just out of it. Just take your personal feelings out of it. It's not about you as a human being. It's not about you. It's about how you performed this particular thing, this particular exam, how you performed on writing this particular paper, or how you performed this particular skills checkoff, or whatever it is. It's about that. It's not about you. So you have to take yourself out of it and realize that you are not the exam. You are not the skills checkoff. You are not the paper that you wrote. Okay, those are just separate things. You have to take those personal feelings away from it. And then think of it for what it actually is. Critical feedback or negative feedback, if you want to use that term, does not mean that the person is criticizing. Okay, they are actually providing you some constructive feedback that will help you grow. So when you're in nursing school, you're learning how to connect concepts, right? That's one of the big things that nursing students learn. Connecting concepts. This means this. This affects this. If the patient does this, then this is going to happen, right? So critical feedback does that same thing for you. It helps you connect that concept from where you are right now to where you need to be in order to grow and be the best possible nursing student and nurse that you can be. So actually, critical feedback or constructive feedback is actually way, way, way more helpful than positive or reaffirming feedback, okay? Because it's actually going to push you further forward. That's why when you get complimentary feedback or positive feedback, I want you to ask for more feedback. Try to get to that place where there is some constructive feedback happening, because it's so much more powerful. This person is telling you exactly what you need to do to be even more amazing. That's a huge gift. So we're really appreciative of people when they give us that really thoughtful feedback. So I know I used to take feedback really, really hard, and I would just I would take it personally. I would beat myself up for the whole rest of the day. I mean, what a waste of time, right? So instead of doing that, can you instead of like running away from the feedback, can you rise up to the feedback? And I totally believe that you can. It just takes a little bit of practice, and it takes pulling your personal feelings out of it. So I've seen this happen with students in clinical where they're getting some in the moment constructive feedback, and sometimes the first response, the first reflex is to start getting defensive, right? To start saying, well, yeah, but, and then trying to defend and explain away the feedback. Don't do that, okay? I do want you to talk through your thought process with your instructor or the person giving you feedback so that you can see where your thoughts, your critical thinking, your clinical judgment went sideways, because they can help you steer that back. But don't start there. Start with saying, thank you for the feedback. I do remember, for example, I do remember you telling us how important it is to pre-oxygenate the patient prior to suctioning the tracheostomy. I'll remember to do that next time, or whatever it is. Or thank you for the feedback. I can see why that technique is actually going to be safer for the patient. In my thought processes, I was going this way. Can you show me where I went wrong? And then that's how you can kind of start explaining through what you were thinking so they can steer you back the right direction. Okay, so it's actually really easy, and I totally believe that you can do it. And then guess what? Then you just move on with your life. You don't have to let it take over everything for the rest of your day. And then if you want to go to that next level, again, you're going to seek out that feedback. Do you have any additional feedback for me? Do you have any feedback for what I could do differently or improve on for next time? And that's just so next level. That conveys so much confidence and will actually help you be even more stellar as a student, as a nurse, as a human being. Okay, so your key takeaways from this is that feedback is not personal. It is not an attack on you. You are not the exam or the task or the skill or any of that. It is not about you. It is about the thing that you're trying to learn how to do. And it takes time to learn things, and you're not going to be perfect right out the gate. And that's fine. That's absolutely fine. Learning is an active verb. You're learning. You're in the process of learning. It's totally fine to not get it 100% right the first time or even the third time, as long as you're learning as you go and improving each time. And feedback is provided as a way for the person feedback from the person is a gift. I want you to understand that. And it is a way for them to help ensure that you are a safe and confident and competent nurse. And then the last takeaway is, if you want to really take it to the next level, to actually go and seek out feedback, or when you're given feedback, to seek more, especially if you're given that complimentary or that positive feedback. Try to get it to a place where you're getting some constructive feedback, okay? So that is it for today. That is us talking about feedback in nursing school and how you're not going to let it derail you. You're going to let it actually bolster you and make you more confident in clinical, in school, at the bedside, all the places, okay? So I will be seeing you all tomorrow, hopefully without all of the tech glitches that I had today. Oh my goodness. And we're going to be just going through a few things that I wish I had known before I started nursing school. So we'll be talking about those tomorrow, and I will see you back here for that. Okay, bye.